We can only really be sure that we're delivering safe care for patients if all the healthcare workers involved have received the right training and are up to date. A healthcare professional who has not received appropriate training or guidance may feel under a lot of pressure to just do the job. There can be a lot of pressure to cope with the workload by operating outside their competence, especially for junior staff. Such staff may not be well placed to judge their own level of competence. They may be over or underconfident because of their limited experience. This is a potentially dangerous situation where errors can easily occur. In the film, it was obvious that nobody had a clear understanding of the level of training or experience that the newly appointed Dr. Campbell had.
Oh, Dr. Livingston, before you go, I just wanted to be clear about the amount of clinical work Dr. Campbell will actually be doing.
How much have we got? He'll take on virtually anything I would. If he's unsure about anything, then I'm always here to help.
So he's familiar with the IT rules?
Well, I would certainly expect so. He's very senior, Anne. He can do just about anything I can.
But Fiona, he's not on the IT register yet, is he?
No, but I'm seeing Dr. Munro about that later and we'll sort it out then.
Sister Lynch, in fact, queried this several times with his colleague, Dr. Livingstone. Despite this lack of clarity, Dr. Campbell was left in charge once Dr. Livingstone left the ward.
Sister Roberts, I'm Dr. Campbell, covering for Dr. Livingstone today.
A culture where healthcare workers help each other, especially when staff are stretched, may inadvertently increase the risk to patients. Often, many staff may not easily recognise the boundaries of their own expertise and experience. Poorly trained healthcare workers can be a major contributing factor, leading to adverse events. Many countries are good at ensuring a certain standard as part of undergraduate training. However, in many cases, the last assessment a healthcare professional faces is at their university or college. Assessments are not just about ensuring a certain and sustainable level of skill, knowledge, or competence. They're also a reflection of a wider culture of safe and effective practice. Education and training are critical components in the quest to improve patient safety. At the very least, all healthcare workers must understand the key concepts of patient safety. For those already in practice, programs must be developed to give them the skill to continue to practice safely. Most of all, healthcare professionals should know and understand safety procedures in their own local service context. In other high-risk industries, careful attention is paid to ensuring the ongoing competence of frontline staff. For example, a typical airline pilot would probably have something like 100 assessments of their competency over the course of their career. In some countries, doctors have none. For your organization, ask yourself the following questions. How do you know that the colleagues you work with have received the training they need to do their job well? Do you have a way of assessing colleagues you work with to ensure they're competent? Do you have a framework in place to ensure induction with local procedures? Do you know what you should do if you have concerns about the competence of your colleagues and the safety of their practice? Would you be supported in raising your concerns? And finally, how would you know if your healthcare system allowed an unskilled or untrained healthcare professional to practice?